Hello, students, and welcome to week 5. For week 5, you have 3 chapters in your textbook that we're going to be looking at in your main textbook, the Crooksbauer and Widman text. The first chapter is chapter 10 on contraception, and then we're going to follow that up by children and conception, and then chapter 15 on STIs. So exciting stuff this week. This is the second part of the physiology topic. So we started in chapter 4 talking about the specific body parts and functions and all of that stuff. And then this week we're going to be talking about what those parts do. So we're going to be talking about, the act of having children, sexual dysfunctions, and things like that. Infertility issues and the risks of STIs and things like that. So starting with chapter 10, contraception. It goes a little bit into the historical and social perspective of contraception in the United States. And so at different points, there's been different types of contraception that has been legal to use or not, or illegal. And there's been a lot of changes over the decades in regards to that. So, the beginning of the chapter just kind of gives you a little bit of background on that, especially with birth control pills and such. The critical thinking question that it first asks is, how does the belief that abstinence is the only moral form of birth control play out today? And, it's possible that some of you hold that as a personal value and belief for yourself. And so and some of you might not. And so what do you see in like the socio-political climate and kind of the impacts of that? And of course, that is followed by a text box on the next page about sex and politics. The next critical thinking question gets into what role, if any, did religion play in your parents' contraceptive use? What about your own birth control decisions, if this question applies to you? And so that's something that some of you talked about in your pre-course reflection, but it's definitely something to think about if it wasn't something that you talked about at that point. The chapter then follows that up by access to contraception and the importance of that and what kind of factors and impacts that has. Talks a little bit about like Planned Parenthood and the availability of different contraceptive methods. And it talks about it, it starts off talking a lot about the history of the United States, but then it talks about it as a global issue as well. So we get a little bit into the broader range of things. So the next critical thinking question is, how are the limits to contraception access put into place by pro-life religious groups compatible or incompatible with freedom of religion? And so kind of thinking about that value that our country holds, and if we think that that's in line with or not in line with the idea that there should or should not be access to contraceptions. Next, it talks about sharing responsibility and choosing a birth control method. So kind of recognizing that it takes 2 people to at least get pregnant, to conceive. And so it should be 2 people involved in that conversation and 2 people taking responsibility for it, again, at a minimum. And then it talks about choosing a birth control method, and it has on 274, it starts this table that talks a lot about different contraceptive methods and their effectiveness and how you use them, advantages, disadvantages, and all of that, which could be helpful if this is information that you personally do not have and could use, but also information that's good to know for clients, because if that you find out they're on a certain birth control method and they complain of these different issues, you can say, I think that may have been one of the potential side effects of it. Or, already knowing a client's history and then they're seeking a birth control method, you might kind of say, oh, well, knowing your history with depression or anxiety or whatever might be a factor. These are ones that you might want to stick away from or move away from. Like there are some that or non-hormonal methods, so people who have a big fluctuation with hormone levels and moods, throughout the monthly cycle, that would be really important to look at, so that, they potentially could choose something that doesn't increase the likelihood of those mood variations and difficult emotions. talks about like rates of use and things like that, use of multiple contraceptives to increase effectiveness, so some that work well together and some that don't. Talks about outer course, which is a really important topic because, as we talked about, I think earlier in the semester, when people think about the definition of sex, they often think about the idea of penis and vagina sex, which is not the only form of sexual activity. Outer course is also a form of sexual activity. And for especially people who have other issues with sex, like painful sex or disorders that cause them discomfort or, inability to gain or maintain an erection and stuff like that. Outer course is something that may be necessary for them to engage in physical intimacy. But it can also be used for people who are just choosing not to engage in penis-vagina sex for whatever reason, or, intercourse sex for any reason. Your sexual health, there's a little quiz on there that you can go through. Talks in more detail about hormonal-based contraceptives, and specific ones, and injected contraceptives and implants, and then barrier and spermicide methods. So things like condoms and how to use condoms, and different ways to combat when, an individual's like, well, I don't want to wear a condom for these reasons. You can say, well, this, that, and kind of combat that if you feel like it's important. It talks about the female condom, which is not as popular. Even though your textbook uses the term the female condom, it's really important that we try to switch or change the language to an insertive condom, because it can be used with any individual who has a vagina, whether they are male or female, and with their gender identity. And it can also be used in the anus of any individual, and potentially you could even use it for oral sex. And so it has, lots of different uses. And so it was initially named the female condom, but has definitely expanded its usage since then. Talks about different kinds of spermicides and how they work, cervical barrier methods, intrauterine devices, so people who get IUDs and some of the risks and factors there. It also talks about emergency contraception, which is also a pretty controversial topic about what exactly these methods do. And so you're going to learn all about that this week. It is not legalized abortion. It just works to prevent fertility from happening if it has not already happened. Fertility awareness months, or methods rather, so using the calendar method, either whether you're trying to prevent pregnancy or get pregnant. Standard days method, mucus method, basal body temperature is another big one that people use. Symptothermal method, and then it goes into sterilization and different forms of sterilization that can be used. And so typically when you think of sterilization methods, people think of vasectomies and getting tubes tied, but there's different ones there, and it's important to kind of have an idea of the impacts of those and helping individuals make informed decisions about them, or kind of dealing with the after effects of that. Then there are some what they call less reliable methods, like the withdrawal method and lactational anorrhea method. So when a woman or an individual is breastfeeding a child, they usually don't get their monthly cycle for quite some time, perhaps the whole time that they're breastfeeding. And so some people think that that's a pretty reliable way to prevent pregnancy, is, engaging in sexual activity during that time. Some people also engage in douching to try and prevent pregnancy. However, this is ineffective in many ways, and sometimes can actually increase how fast the sperm gets to where it needs to go. So it could have sort of the opposite effect. And then it talks about new directions, and so places that we're kind of researching and places that we could go when it comes to contraceptive methods. So it's a pretty comprehensive chapter. It goes over a quick summary of the chapter at the end, which is good. Then we move into chapter 11, which is conceiving children, so process and choice and being able to make those decisions. parenthood as an option, becoming pregnant. There's going to be some resources that I put below that are going to help kind of discuss some of these topics. Infertility, I'll get back to that later. That's what our discussion post is on this week. It talks about different types of fertility treatment for quote males and quote females. So individuals with who produce sperm and individuals who produce eggs, the financial costs, legal and ethical issues related to it. Also spontaneous and elective abortions. And so spontaneous abortions are what some people might call miscarriage and stillbirths, and elective abortions is making the decision to have an abortion for whatever reason. The individual may, talks about different rates of abortion procedure. So exactly what does it do? It talks about the impact of illegal abortions. And so when abortion is illegal in different countries, and as it was here in the United States at one point, the dangerous methods that individuals would go to terminate pregnancies. Goes into the controversy. Again, this is a very controversial topic, discusses Roe v. Wade and the current debate that we're having. Of course, it gets into sex and politics because, again, this is a big political issue. Gets into the experience of pregnancy, interactions, sexual interactions during pregnancy, and what kind of factors may play a part, cause issues, or maybe actually increase drive. What a healthy pregnancy looks like. It talks about all the fetal development, prenatal care. One of the things that I had read a number of years ago is the What to Expect When You're Expecting, and there's been a number of iterations of that book over the years, and so it's gotten updated over time. And even if you're not going to be pregnant or don't want to ever get pregnant or anything like that, it actually is a pretty good resource to have. It gives a lot of information. And so your textbook covers some of it, but of course that's an entire book on it. It talks about the importance of folic acid in fetal development, prenatal care, different risks that there could be to fetal development, the impacts of pregnancy after the age of 35. So for the individual carrying the baby, there can be some increased risks, and also some risks with fatherhood after the age of 45. It talks about childbirth, and so kind of the labor and delivery process and different factors that can happen there with vaginal birth versus cesarean sections. Talks about after childbirth, breastfeeding and how that sort of works, and different things that impact that and how that impacts other areas, and then how sexual interactions after childbirth kind of change things. And then finally there's the summary at the end of that chapter. Actually, I didn't notice if there were any thought questions in this chapter. Didn't notice any, but let me go back and double check. Yep. Where do you stand on the abortion debate? What factors have impacted your personal attitudes? Which is a really important thing to kind of really think about, because, regardless of where you stand on the issue, you're likely to have clients on either end. And if they're talking with you about this topic, you want to make sure that your own personal biases are not getting in the way of you being non-judgmental and being able to be supportive and help your clients. The other one is, do you think children conceived by a sperm or an egg, or a donor sperm or an egg insemination, should be told about this, and why or why not? It's kind of an ethical question. Again, it could be something that comes up with clients. They're trying to make the decision on whether or not to tell their children that this was the process of how they were created and developed and stuff. So some good discussion questions there. And then our last chapter for this week is chapter 15. And so 15, I can get to it here, gets into the topic of STIs and risks of sexual activity. Okay. So sexually transmitted infections is officially what it's called. There is a table that goes over some common ones and gives an idea of how they're transmitted and some symptoms that are common. So again, your clients are complaining about these issues. These could be potential things that they might have. How to tell a partner. So a client might say, hey, this is something that I feel like I found out I have. I need to tell my partner, can you kind of help me and guide me along the way? Goes into a bit more detail of the infection, what it looks like. There's some pictures, impacts if you have an STI and you get pregnant, and some impacts that there can be on the fetus. Lots of pictures if you're interested in looking at them. And then it breaks out viral infections as being a little bit different than bacterial infections. And so it breaks those up into categories. Another critical thinking question: have you ever done a blood test to check for herpes, or in fact had any kind of STD testing? It might be a good idea for you to kind of check out what the process is like so that you know what to help clients expect. Another one: oral herpes is not harshly stigmatized as genital herpes. Why is this? So oral herpes is when people get like cold sores or something like that on their lips. And so why do you think that there's more stigma for genital herpes versus oral ones? And do you think there should be stigma attached to either one of these? And so that's kind of an interesting question to consider. Gets into HPV, which is a big one because there are different strains of HPV and they impact in different ways, and it's very, very common. And there is the vaccine that you can get to prevent HPV, which is also very controversial, but again, important. There might be a client who's talking about whether or not they should get it, or even a client who's talking about whether or not they should encourage their child to get it. And so making yourself aware of that is a really good one. Gets into viral hepatitis, common vaginal infections. So these are not necessarily always sexually transmitted, but things that can kind of have an impact on the vagina. Echoparasitic infections as well, such as scabies and pubic lice, how they're transmitted, the symptoms, treatment, all of that. Then we get into HIV and AIDS, which is a topic that really has grown, and we've learned so much about over the last couple decades since it first emerged. And so there's a lot of really great up-to-date information on there, kind of maybe break down some myths or stereotypes that you are familiar with, kind of help you out to know how to talk to your clients about this. It talks about AIDS in Africa and the impact that it's having there, how it's transmitted. Circumcision is a strategy for preventing HIV infection, and so there are people who feel like this would help to prevent it, but of course, there are lots of factors involved there. It talks about the use of PrEP to prevent HIV and AIDS, and also, there's a lot of drawbacks of using it, and a lot of negative impacts you can have for using. There's also another drug that you can use if you've already been infected with HIV that could prevent other people from getting it from you. And so there's two different PrEP, and the other one's called right now. I think it's called PEP, P-E-P, and PrEP is pre. But anyway, so it gets into that a lot. Gives you a lot of information about HIV and AIDS. Critical thinking question: it's been suggested that all sexually active adolescents and adults should be required to get tested for HIV. Do you agree with this recommendation? And how might the results of such testing be effectively used to reduce the transmission of HIV? What problems might occur as a result of mandatory testing? So another kind of like ethical type question for you to think about. The other important thing I think to consider when it comes to HIV and AIDS is that we have learned so much, and we have come a long way in the treatment of HIV and AIDS that, at one point this was considered sort of a death sentence. It was, seen by people as this is it, this is the end, I have like this limited time left. But with all of the advances in treatment, this is not the death sentence that it once was. And so with mandatory testing, would that be necessary? Or would it be, like considering HIV and AIDS sort of similar to other STIs that we don't force people to get testing for? So kind of something to think about. It also talks about preventing other sexually transmitted infections towards the end, kind of gives you a quick overview. Another critical thinking question: what sexual health resources do students have available at your college or university, and how could those services be improved? So do some research. What does UF do? What does UF have? What can you find out? I know Gatorwell is a great source of information, and also actual, items. They give out birth control methods and do a lot of promotion, but, other things at the medical center, even the counseling and wellness center related to sexual health and STIs. Has a little discussion on your sexual health to think about. Then it has a summary, a really long summary of the different STIs that the chapter talked about. And so a little bit content heavy, but you do want to make sure you get into these chapters. They will be covered by your next quiz. So you want to have some good information from those chapters. This week, I kind of alluded to it earlier, we do have 2 assignments due. The discussion post is going to be on infertility and IVF treatment. And so you're going to be watching this movie online. There's a link in the discussion post called Modern Baby, and it follows 4 different couples. And then there's some reflection questions that you're going to want to answer. And so really what it is, you know, what did you learn by watching it? Is there any new information, anything you were surprised by? Were these things that you were already aware of? How would you work with these different couples and what they're going through as far as the IVF treatment, just different things to consider. And so I really look forward to your discussion as far as that is concerned. And then you have your first big assignment due, the sexual interview. And so hopefully you guys have completed that. And in your reflection, I don't want you to share any of your peers' information. Do not record the interviews. You can talk about stuff that you shared during your interview, but not your peer stuff. And just reflect on what it was like to listen to your peer as they were talking and what that experience was like for you, what it was like for you to share, and then finally as the observer. And so, again, I look forward to reading all about your interviews and your comfort level and what you learned and what you still feel like you need to learn. And so that is it for week 5 rather, and you'll see me again for week 6, another video, and then week 7 is our next Zoom meeting. And so following this video, you're going to see a bunch of links to resources that you can kind of consider the lesson for this week, the lecture portion, things that we would go over in class if we were meeting face to face. And so you can use them to kind of supplement the material that you read in the textbook. So have a great week, and thank you all for listening.